Hi, it's good to meet you. My name is Don Tatalovich. I'm the owner of Cornerstone Dental Center. And as far as implants go, like why the interest? Why do we care? With implants, we're just really excited with that treatment option to be able to replace teeth for people. And that's something where in the past there were very limited options to doing that. With the advent of implants, we really have a lot more opportunity to replace people's smiles. What's the difference between an immediate implant and maybe more of a traditional workflow for an implant? So for a traditional treatment process, somebody would generally, if you either have a space missing or you need a tooth taken out and replaced, you would do that, you would allow that area to heal, and then you would come back and you would have an implant placed in that site or that location. For an immediate implant, this is something that if we can take that tooth out and at the same time replace it with that implant in the same surgical procedure, that saves a lot of time for the patient where they're not waiting for healing. In the past, they would have been waiting for healing before coming back and placing that implant. Who would be a good candidate for an immediate implant? And so when we evaluate whether a person, and then we take a look at your mouth, take a look at that site where we're proposing to put an implant in. I'm going to circle back around and start again. So who would be a good candidate for an immediate implant? That's a good question. With implants, we have to keep in mind that we're evaluating the location where the implant's going to go, the site, for the proper amount of bone quality and quantity. And so in order to evaluate that, we really need to take some x-rays and take a look at someone's teeth in order to determine if an immediate implant would be the right treatment for them. So what are the benefits of an immediate implant? With implants, like we've discussed a little bit about the traditional process, or maybe we would say workflow of placing an implant. Some of the concerns with taking a tooth out would be not being able to predict just how the bone is going to heal. So if we have a site that we'd like to place an implant, doing that immediately allows us to control the location a little bit more, and then as we allow that site to heal with the implant, we will have placed a graft in there to try to preserve as much bone as possible. The other large benefit to placing an immediate implant versus a traditional implant is reducing the amount of time that we need for healing to occur. Traditionally, we would allow that site to heal for a couple months to maybe even as long as 6 months prior to coming back and placing an implant. With an immediate implant, we're going to allow that site to heal at the same time the implant is integrating. And so we've potentially saved ourselves, in the range of maybe 3 to 4 or 6 months even. So what does a same-day implant appointment look like? For a patient that we've already had an opportunity to sit down and talk with them about their goals, to come up with a good treatment plan or game plan for them. At this point, we've already decided that an implant is the right solution for their either missing space or a tooth that needs to be removed. So after we've treatment planned that, we'll see you for the surgical treatment day or surgical treatment appointment. With that, we'll take out the tooth that needs to be taken out, if that's what we've determined, or if the site is ready for an implant, we can place the implant in a site with a missing tooth already. With an immediate implant, though, the goal being to take out the tooth that needs to be removed, replace that with that immediate implant that day. The big benefit to this is, as we've already kind of discussed, healing. Our healing time will happen at that extraction site while that implant is integrating. And so for the patient or the person receiving the procedure, that means that you won't have to come in to have an extraction done on the tooth and allow that to heal, and then come back in for another surgical procedure to have the implant placed. We'll be doing both of those procedures that day while you're numb, and then that will roll everything into one surgical procedure for you. So how does technology play a role in the implant process and what we do in our office? So for patients that need an implant, for certain patients, using it's called a surgical guide in order to determine the placement of that implant. A surgical guide can be fabricated. Generally, these surgical guides are digitally designed and then 3D printed. And so those are things that we can do in our office. On the other end of the implant process, we also have the crown that goes on top of that. And so our goal is to ultimately put a tooth back into a missing space to restore your smile. with that, our office, we have an in-office design program and mill that allows us to create that crown in-house as well. And so with all of these steps, we're able to do that in-house, controlling that from start to finish so that we come out with the custom product that's right for you. So I guess some surprises or some feedback about immediate implants. So some good feedback we've gotten from patients about the immediate implant process is healing. With a tooth coming out with an extraction, there's the concern that there could be pain associated with that, or there could be longer healing times. We have had a number of patients that have come back and have given us surprising feedback that they felt like it was not as painful as that they thought it was going to be. It was not as dramatic a process as I thought it was going to be. And so we're really excited that we've been able to provide care to them going through a surgical process and procedure where they're generally pretty comfortable and healing is happening very quickly for them. So if we're considering placing an implant for somebody, if sometimes we have patients will call and they'll wonder if they're a good candidate for this treatment. I think the first step for this would be we'd like to see your teeth, we'd like to see your mouth, we'd like to get a chance to talk with you and figure out what your goals are. And so once we determine where we're missing a tooth or where a tooth needs to be extracted, we can present your treatment options to you. We can figure out what makes the most sense for you and again, what your goals are. Whether those are purely functional or whether there's a large aesthetic component to that too. We really want to figure out what your personalized treatment goals and plan looks like.